This is part 2 of the Yellow Emperor's Classic of Medicine, voice overdone by Deborah M. Stewart, on bone measurement and meridians. The width between two Wangu GB12 behind ears is 9 kun. The length from popliteal to ankle level is 16 kun. From hip to joint to middle point of kneecap is 19 kun. The length from sternosigmoid process to Shan-Shu ST25 navel level is 8 kun. The width between two nipples is 8 kun. Meridians. The lung meridian starts from the middle geo, connected organ, ST, connected orifice, throat, number of branches, 1. The large intestine meridian starts from LL1, connected organ, LU, connected orifice, gum, lower teeth, number of branches, 1. Stomach meridian starts from LL20, connected organ, SP, connected orifice, upper gum, number of branches, 4, meeting point, UB1. Spleen meridian starts from SP1, connected organs, ST, HT, connected orifice, the root of tongue, number of branches, 1. Heart meridian starts from HT, connected organs, SL, LU, connected orifice, eye system, number of branches, 1. Small intestine meridian starts from SL1, connected organs, HT, connected orifice, outer and inner canthus, number of branches, 2. Meeting points, DU14. Bladder meridian starts from UB1, connected organs, brain, K11UB, connected orifice, lumbar, number of branches, 3. Kidney meridian starts from small toe, connected organs, UB, LV, LU, HT, connected orifice, throat, tongue, number of branches, 1. The pericardium meridian starts from the chest, connected organs, PC, upper, middle, and lower geo, connected orifice, number of branches, 2. Triple energizer meridian starts from TE1, connected organ, PC, connected orifice, ear, outer canthus, number of branches, 2. Gallbladder meridian starts from GB1, connected organ, LV, connected orifice, ear, outer canthus, number of branches, 2. Liver meridian starts from LV1, connected organ, GB, connected orifice, eye system, number of branches, 2. The Han-Taiyan channel of lung starts from the middle geo, goes to large intestine below, returns to pass through the upper entrance of stomach, ascends through the diaphragm, and links to the lung. The 8 extra meridians. Number 1, the governor vessel. The governor vessel arises from the lower abdomen and emerges from the perineum. Then it runs posterior along the interior of the spinal column to Feng Fu, GV16, at the nape where it enters the brain. It further ascends to the vertex and winds along the forehead to the columella of the nose. The coalescent points of governor vessels are Fengmen, BL12, and Huyen, CV1. The clinical actions are number 1, the tonifies kidney yang. 2, it strengthens the back. 3, it nourishes brain and marrow. 4, it strengthens the mind, the shin. 5, expels exterior wind. And 6, distinguishes interior wind. Number 2, conception vessel. The conception vessel starts from the inside of the lower abdomen and emerges from the perineum. It goes anteriorly to the pubic region and ascends along the interior of the abdomen, passing through the ganglion, the CV4, and the other points along the front midline to the throat. Ascending further, it curves around the lips, passes through the cheeks, and enters the infraorbital region, the Shin Qi, ST1. The coalescent points of the conception vessel are Qing Qi, ST1, and Yinjiao, GV28. Clinical actions. Number 1, it nourishes the yin. Number 2, it regulates uterus. Number 3, it moves qi in the lower geo and uterus. Number 4, it promotes lung qi descending and kidney qi receiving. Number 5, it promotes the transformation, transportation, and excretion of fluid. Number 6, it activates the Sangeo. Number 7, it controls fat tissue and membranes. Number 8, the combination of Ren and dew points. 3, thoroughfare vessel. The thoroughfare vessel starts from the inside of the lower abdomen and emerges at the perineum. Ascending, it runs inside of the spinal column, where its superficial branch passes through the region of Qigong, ST30, and communicates with the kidney meridian of Foot Sheyin. Running along the both sides of the abdomen, it goes up to the throat and curves around the lips. The coalescent points of the thoroughfare vessel are Huyen, CV1, Hingju, KL11, Dahi, KL12, Quixu, KL13, Siming, KL14, Zhongzhou, KL15, Hunshu, KL16, Shangqiu, KL17, Qigong, KL18, Yindu, KL19, Futungu, KL20, and Yumin, KL21. Number 4, the belt vessel. The belt vessel originates below the hypochondriac region and runs obliquely downward through Daimei, GB26, Wushu, GB27, and Weidao, GB28. It runs transversely around the waist like a belt. The coalescent points of the belt vessel are Daimei, GB26, Wushu, GB27, and Weidao, GB28. The clinical application is number 1, it harmonizes liver and gallbladder. Number 2, resolves dampness in the lower geo. Number 3, it regulates qi circulation of legs. Number 4, it activates the qi of stomach channel in the legs. Number 5, the girdle vessel, Daimei, problems with the abdominal pain. Number 6, gynecology. Number 7, fullness and emptiness of girdle vessel. Number 8, girdle vessel and hip. Number 5, yang heel vessel. The yang heel vessel starts from the lateral side of the heel, the Xingmei BL62, Puxin BL61. It runs upward along the external malleus and passes the posterior border of the fibula. It then goes onwards along the lateral side of the thigh and posterior side of the hypochondrium to the posterior axillary fold. From there, it winds over to the shoulder and ascends along the neck to the corner of the mouth. Then it enters the inner canthus, Jingming BL1, to communicate with the yin heel vessel. Running further upward along the bladder meridian, a foot Taiyang to the forehead, it meets the gallbladder meridian of foot Sheyang and Fingqi, GB20. The coalescent points of the yang heel vessel are Xingmei BL62, Puxin BL61, Fuyang BL59, femur Julio GB29, Naoshu SL10, Jianyu LL15, Jugu LL16, Decan ST4, Nose Julia ST3, Qingqi ST1, Jingming BL1, and Fingqi GB20. The clinical actions are absorbs excess yang from head. Number 2, the eye. Number 3, mental problems. Number 4, backache and sciatica. Number 5, the hip. 6, the yin heel vessel. The yin heel vessel starts from the posterior aspect of the navicular bone, Zeihei K11-6, ascending to the upper portion of the medial malleus. It runs straight upward along the posterior border of the medial aspect of the thigh to the external genitalia. Then it goes upward along the chest to the supraclavian fossa and runs further upward lateral to the Adam's apple in front of Renyi ST9 and then along the zygoma. From there, it reaches the inner canthus Jingming BL1 and communicates with the yang heel vessel. The coalescent points of the yin heel vessel are Zeyuha K11-6 and Geoxin K11-8. The clinical application is sleep, atrophy syndrome, Weijin, and abdominal pain. Number 7, the Yang Link vessel. The Yang Link vessel originates from the heel Jinmin BL63 and emerges from the external malleus. Ascending along the gallbladder meridian of the foot Sheyang, it passes through the hip region. Then it runs further upward along the posterior aspect of the hypochondriac and costal region, and the posterior aspect of the axilla to the shoulder and to the forehead. It then turns backward to the back of the neck, where it communicates with the governor vessel, Feng Fu GV16 and Yamin GV15. The coalescent points of the Yang Link vessel are Jingming BL63, Yangjio GB35, Naoshu SL10, Tianliu TE15, Jianji GB21, Benxing GB13, Yangbei GB14, Tolingqi GB15, Mushuang GB16, Ziying GB17, Qingli GB18, Naokong GB19, Fengqi GB20, Fengfu GB16, and Yamin GB15. The clinical application. Number 1, intermittent fever. Number 2, side of body. And number 3, ear problem. Number 8, Yin Link Vessel. The Yin Link Vessel starts from the medial aspect of the leg, Zhu Bing, K11-9, and ascends along the medial aspect of the thigh to the abdomen to communicate with the spleen meridian of foot Taiyin. Then it runs along the chest and communicates with the conception vessel at the neck, Tian-2. CB22, Lian Quan, CB23. The coalescent points of the Yin Link Vessel are Zhu Bin, K11-9, Fouché, SP13, Dehin, SP15, Fouet, SP16, Kumin, LR14, Tian-2, CB22, and Lian Quan, CB23. The clinical application is number 1, it nourishes yin in blood, number 2, mental problems, and number 3, headache. This concludes the overview of the Yellow Emperor's Classic of Medicine. If you have any questions, my contact information will be listed below. Till we meet again.